Barney is a 12 to 12 and a half year old Karen Terrier mix. He was rescued from an emergency clinic. He lives in a household with 2 other dogs, 2 cats, and several chickens. So since Barney's a mature dog, we'll be looking at his vaccine schedule to see what vaccines he needs. He may not need all the vaccines that a young dog needs. So with his family, we'll decide which vaccines are best for him, and also based on his history. We'll also be listening to his heart, we'll be listening to his lungs, and listen to all 4 sides. Everything's nice and quiet. Examining his eyes, his ears. You just want to make sure that they're nice and clear. Good. We don't see any cataracts. But we're still going to look at his ears, make sure he doesn't have an infection. Good. Eardrum looks good. We'll do an oral exam of his teeth as much as he'll let us do. He's got a little bit of gingivitis right on that tooth. We're going to open up Barney's mouth. Good job. We always want to reward them if they did something right. We'll also check his joints for any pain or discomfort. So now we're just going to take and stretch Barney's shoulders, his elbows. Just make sure that he's got good range of motion and no discomfort. We're going to go to his hips. We're just stretching, checking his knees and his little ankles. So far, Barney's not showing any pain or discomfort, which is excellent. As a senior mature pet, additional things that we'll do is x-rays of his chest to look at heart size and his lungs, check for lung tumors. It's very important in dogs over 8 years of age. We'll also be x-raying his abdomen. We'll be looking at liver size, kidney size, checking for bladder stones, making sure his back looks okay. And of course, we'll check his blood pressure today as well. We're going to give him a treat just to let him know it's okay, because Barney's all about food. All right, so we're going to check Barney's pressures just to make sure he doesn't have high blood pressure. And so Barney's blood pressure is 127/60. That is excellent. So we're going to pull a little bit of blood on Barney. So when we pull blood on dogs, we usually go from the neck. It's less painful. We get really good samples. So we'll send this off to the lab and have them check his liver and kidneys and heartworm and cholesterol, his electrolytes, his minerals, and his blood counts. Make sure everything looks good. Vaccines are very important. You know, the veterinarian helps the family decide the vaccines that are correct, and not all dogs are going to take every vaccine, and for some dogs it's not the best for them. But most vaccines should start between 6 to 8 weeks of age, and it's important to do these vaccines as puppies approximately every 3 to 4 weeks. What some people don't realize is that some of the vaccines that we're doing for their pets, dogs or cats, are not just for the cat and dog, but in essence also help protect the family. Rabies, everybody knows about, very important vaccine. There's been outbreaks, around Dallas in the past several years, and by giving your vaccines as you're directed with your veterinarian, you provide protection for your pet as well as for the rest of your family.
Next week, Vet Check zeroes in on too many LB.